Good afternoon. It's great to see so many familiar faces, including my mother, and to be back here in Portland. Today I'd like to do two things. First, I'd like to describe how I learned as a young physician in training about the social determinants of health and why public health matters. And the second thing I'd like to do is describe my first step as the Dean of the OHSU PSU School of Public Health in improving the health and well-being of Oregon. But before I get into that, I want to describe my favorite part of the day and also the most important part of the day. And that's having coffee with my students and going to their classrooms. I go to coffee with my students to learn about their life story and their future ambitions. I go to their classrooms to learn what, and more importantly, how they're learning. This is the most important part of my day because these are the students that will prevent depression in 1/3 of Oregon women. These are the students who will reverse the explosive increase in opioid overdoses, which causes more deaths than road traffic accidents. These are the students who will figure out a way how to deliver early childhood education and basic health services to the 138,000 children in Oregon under 5 without such services. The reason they will do that is they know that without early childhood education, without basic health services, these children are unlikely to graduate from high school and become economically independent. These students are our future health and well-being. And it's great to be surrounded by so many students at OHSU and PSU. These students make my life enjoyable. I left Oregon when I was 18. My ambition was to go to college to study neuroscience. And then to come back, I came back each summer to work in an OHSU neuroscience laboratory. In fact, OHSU was the first job I ever had, and PSU was the first class I ever attended while attending high school at Lincoln High. I went off to study neuroscience, and I returned each summer to work in a neuroscience lab. My ambition was to become a brain surgeon, maybe even cure brain disease. I had my dream. I worked hard in college, and I was able to secure 1 of 5 full scholarships at Johns Hopkins Hospital to pursue both an MD and a PhD in neuroscience. My dream has started. Little did I know that East Baltimore would change that dream. I drove to Baltimore in my 1976 Toyota Celica, and my first stop was the medical school housing office. I walked into the housing office. They had a bulletin board with a list of landlords or phone numbers. I wrote some phone numbers down. I made a few phone calls. And I walked back out to my car, and I locked my keys in my car. There was a man standing on the corner. He saw my predicament. He said, "I think I can help." He pulled a tool out of his backpack. He jimmied the lock, and the door was open in 3 minutes. I said, "Wow, you saved my bacon. Thank you so much." He said, "You seem like a nice guy. How'd you like to come over to my place and smoke some crack?" I said, "That's really generous, thank you." But I got an appointment with my new landlord, I don't want to be late. Maybe next time. Then 2 months later, two of my college friends, Mavis and Harris, came down to visit. They picked me up at the library about 10 o'clock at night. I hadn't had any dinner and I was starving. So we went to the local fast food place about 3 blocks from my house. We got out of the car, and there was a half dozen teenagers in the parking lot. They circled around us, seemed kind of tense. So I looked at one of the teenagers and said, "I don't want any trouble, man." He said, "Don't call me man," and punched me in the face. Thankfully, the attendant in the fast food place saw what was going on, knew the teenagers, and chased them away. Then I had my first patient as a medical student. His name was Anthony. Anthony was a tall, muscular, African-American man admitted to the hospital with endocarditis. Endocarditis is an infection of the heart valve, often caused by injection drug use. The medical residents called such patients shooters with a fever, or even dirtball. My job as a medical student was to go into Anthony's room each morning to ask him about his symptoms, record his vital signs. I am terribly embarrassed to say that the first time I walked into Anthony's room, I was scared. I actually thought that Anthony might hurt me. I walked into that room with my short white coat, and Anthony said, "Good morning, doctor." I explained, "Well, I'm just a third-year medical student. I'm not really a doctor." And Anthony greeted me with appreciation, intelligence, and a wicked humor. It was the highlight of medical school. But I was confused. Was this what the young medical doctors were calling a dirtball? So I went up to my chief resident and I asked him, could I follow every injection drug user with endocarditis? He looked at me kind of perplexed. And he said, "Well, I guess. No one else wants to." And so I did. I followed about 20 injection drug users with endocarditis to see whether Anthony was the exception or the rule. And of course, no patient was just like Anthony, but each patient had a rich, compelling, and often tragic story. It was that month that I realized I was a racist. I had no idea I was a racist growing up in Portland, Oregon. I thought America was a land of opportunity where everyone could dream of becoming a brain surgeon, even curing a brain disease. Little did I know that the reason I could have that dream is because I grew up in the West Hills of Portland, Oregon, and not East Baltimore. And I would soon learn that the zip code you're born in not only determines what school you go to and what opportunities you have, it determines your health, your family's health, and your community's health. And the difference between a good zip code and a bad zip code is 25 years of life. And what makes it worse is that a difference between a good zip code and a bad zip code is often the difference between rich and poor and black and white. It just wasn't right. And that's why public health matters. The other thing happening in Baltimore in the 1980s, as well as many other major US cities, was there was a new disease called HIV/AIDS. At that time, a positive HIV diagnosis meant you had 6 months to live. I started testing gay men, injection drug users, and their female partners at a free gay men's clinic in Baltimore every Tuesday night. I tested 9 patients HIV negative until I met Paul. Paul was a homeless gay man who was kicked out of his house when his parents learned he was gay. He was 17 years old and came in for an HIV test because he wasn't feeling well. I said, don't worry, there's a flu going around and everyone I test is negative. Paul came back a week later for his results. I opened up the book and I read HIV positive. I awkwardly tried to explain what that meant to Paul. He didn't hear a word. That night, he was admitted to Johns Hopkins Hospital, and I saw him every day for the next 3 weeks until he died of pneumocystis pneumonia. The highlight of medical school was curing Anthony's endocarditis, but more importantly, earning his respect and trust. The low point was seeing Paul die. It was at that point I realized that public health matters. This isn't right. We, or I, need to make a difference. So I gave up my full scholarship to study neuroscience. It cost me about $150,000 to go care for the Pauls and Anthonys of the world. My next stop was the only neighborhood which had more injection drug use, more HIV, more urban violence than Baltimore, and that was North Harlem in New York City, where I trained as a medical resident at Columbia Presbyterian Hospital. At Columbia Presbyterian, I'd see 200 people dying a year, often 2 to 3 per day, many of them younger than me. An African-American male child born in Harlem at the time was unlikely to live as long as a male child born in the slums of Bangladesh. It just wasn't right. And that's why public health matters. I next moved to San Francisco to join the faculty at UCSF and become an AIDS specialist at the Mecca for HIV care, training, and research, San Francisco General Hospital. Shortly after arriving in San Francisco, there were new drugs discovered to treat HIV. These miracle drugs turned HIV from a death sentence to a manageable chronic disease. Though not everyone received these miracle drugs. People were concerned that if you gave such miracle drugs to the homeless, the mentally ill, to drug users, that they would miss their medications, the virus would replicate, mutate, and become resistant to these new drugs, such that we should withhold people at risk for what we call non-adherence. We started a program to learn how to deliver HIV medications to homeless people living with HIV. I remember one day in the program, I had my 4-year-old daughter visiting. I had just finished interviewing a woman who was an injection drug user and also a sex worker. I don't remember her name, but I remember the scars on her arms and even the scars on her neck where she would inject when she couldn't find a place to inject in her arms. I left to organize the paperwork to review the information I collected, and I saw my daughter, Brooklyn, sitting on her lap. This woman was admiring a bracelet that my daughter had made in preschool that week. She was not just admiring the bracelet, she was admiring every single bead. And my daughter was just soaking up the attention. Finally, someone appreciates me. It was at that point that I realized I had prejudged this woman in the same way I prejudged Anthony. This was not a notice of transmission for the San Francisco HIV epidemic. This was a mother who loved and terribly missed her 3 children that were taken away by Child Protective Services and was cherishing the opportunity to have a young daughter in her lap. I next turn to Uganda in sub-Saharan Africa, the home of 90% of the global HIV epidemic. But no one was being treated. There was the same concern. If we provide these drugs, these miracle drugs, to the poorest, the least educated in the world, they'll miss their doses. The virus will mutate, become resistant, and this resistant virus will spread throughout the world. We started raising money in $50 or $20 donations in the hopes that when we raised enough money to commit to provide someone 5 years of treatment, we could start that person on treatment and hope for the best in the future. We raised our first $2,000, and I went to the clinic director and asked, of the 5,000 people in your clinic, which one do we put on treatment first? They picked this man, Eliza Muzunguzi. They picked Eliza because Elijah was leading a song and dance troupe. He would go out into the village to sing and teach people about HIV prevention. The clinic said, if we help Elijah, Elijah will help others. That was 16 years ago. He recovered from tuberculosis meningitis, became healthy and strong, and then led a program that taught hundreds of families how to manage a household business to raise them out of poverty. I now come back to Portland at a time where we have neglected public health crises, just like we had HIV in Baltimore, New York, San Francisco, and sub-Saharan Africa. We have an explosive epidemic of depression, substance use, and suicide. We have been too long at addressing overnutrition, underactivity, leading to obesity, diabetes, cardiovascular disease, and cancer. A pregnant woman with 2 minimum wage jobs have such high levels of stress hormones that those stress hormones are literally rewiring her baby's brain to make that baby at risk for learning disorders, depression, anxiety, make that baby at risk for drug and alcohol abuse, thus making that more challenging for that baby to raise that mother's grandchildren and bring them out of poverty. And as Joe said, we are facing amazing, powerful changes in how healthcare will be financed here in Oregon and abroad. For better or for worse, we need to be right in there and describe what the impact of those changes are. And finally, we have waited too long to address racism and implicit bias as a public health issue. Because if a well-meaning but even naive young man from Portland, Oregon, can have implicit bias shape his attitudes and behaviors in delivering health care, implicit bias can do so much more. And we need to address this as a public health issue. So where do we start? Well, I believe that if we can tackle HIV in Africa, we can tackle these same challenges here at home. And we start with where I began, our students. This is Willow Wallace and her grandma, one of the first students I met at the OHSU PSU School of Public Health. Willow lived in more than a dozen zip codes because her mom had a hard time making rent. Her mom joined the US Army and served 2 tours of duty in Iraq. When she came back from her second tour of duty, she had disabling PTSD and could no longer care for Willow. Willow left home, couch surfed, became homeless, once she was emancipated, got a job in Jamba Juice, made $600 a month, but still had to pay $400 a month rent. She said, "This is not working. I need to do something better." So Willow turned to what she knew, and that was the US military. And she thought of her grandma. What will I do in the military? Well, my grandma is a certified nurse assistant. She cares for people. She finds that meaningful. She finds that rewarding. I want to be like my grandma. Maybe I'll go into the Navy and become a hospital corpsman. So Willow took the vocational aptitude test in the US military. And she scored in the 99th percentile and said, "Wow, I'm smart. Maybe I should go back to school." So she finished her GED and enrolled in Portland State, now our School of Public Health, part-time as a microbiology and public health major. She did so well in her coursework, she got a full scholarship and started going to school full-time. This summer, she'll be working in Louis Picker's lab with the goal of becoming a physician scientist because she wants to learn from Louis, who's not only on the heels of curing tuberculosis, but also HIV. I've looked at Willow's transcript, and she is rocking it. And I wrote her letter of recommendation to apply for MD, PhD programs, and she's going to have a pick. We're going to have to work really hard to keep her here in Oregon. And I'd like to introduce Willow. Stand up, Willow. And that handsome guy to her right is Sebastian, her fiance. Willow's going to be a great physician scientist, not just because she's smart and hardworking, but she's seen suffering and understands empathy. She's also seen difficult times and has the tenacity to see a problem through. Willow is an example that, yes, zip codes matter, but they're not the end of the story. And that's why I go to coffee with my students, to make a difference one student at a time. My last job was at Harvard, where we also have great students who will change the world. But those students are going to change the world no matter where they go to college, even Yale. Harvard prides itself on being the most selective institution in the world. That also means that they pride themselves on saying no. We at the OHSU, PSU School of Public Health are different. We pride ourselves on how many people we can say yes to create an opportunity, a career pathway, such that that student can make a difference. This is such an important issue to me that my wife, Lynn O'Kelly there, and I have given $100,000 in student scholarships to support students like Willow. Thank you. The biggest gift we ever made was $100 to NPR. This is in the philanthropy circles what we call a reach gift. But it is that important to us. We need 1,000 Willows. Willow will care for thousands of patients as a physician. She may even impact the lives of millions when she cures that disease. No pressure, Willow. If we have 1,000 Willows, we can change the lives of millions of Oregonians. And that's where I need your help. Here's my email. Send me a note if you want to make a donation to the Dean's Scholarship Fund to help students like Willow, or if you know somebody who does. Send me a note if you want to buy Willow and Sebastian a wedding present. Send me a note if you want to take the first step at tackling a neglected public health crisis here in Oregon. On February 16th, we'll be having an event called Oregon on Opioids. There'll be flyers outside. Send me a note if you want to help me make the OHSU, PSU School of Public Health the premier destination for learners who want to make Oregon and the world a better place. Thank you.